ActiveCare plus SFT, the effective and safe way to prevent deep vein thrombosis. Welcome. This video is designed to show you how to use ActiveCare plus SFT and to help you explain the importance of the system to your patients. The importance of DVT prevention. Deep venous thrombosis, or DVT, is one of the most prevalent medical problems today, affecting more than 2 million Americans each year, with 600,000 of those developing pulmonary embolism, a silent killer with symptoms that often occur unnoticed. ActiveCare plus SFT is a breakthrough innovation, offering a safe and effective way to prevent DVT and its deadly consequences. The system works by using synchronized flow technology, SFT, an advanced system that applies gentle, intermittent compression to the legs in a systematic pattern, timed to the patient's venous phasic flow. This increases the blood flow in the veins and reduces the risk of clot formation. ActiveCare plus SFT is the only clinically proven, non-pharmaceutical and mechanical solution that provides your patients with continuous protection throughout the time of high risk, both in hospital and post-acute care. ActiveCare plus SFT system, clinically proven results. In a recent clinical study, the ActiveCare plus SFT system was compared to a low molecular weight heparin. Results demonstrated no statistical difference in the incidence of VTE, but there was a big difference in major bleeding events. The Lovenox enoxaparin group demonstrated major bleeding events in 5.6% of the patients, while there were no major bleeding events in patients using the ActiveCare plus SFT system. In another study comparing ActiveCare with IPCs in addition to Lovenox enoxaparin, ActiveCare arm demonstrated a 70% reduction in DVT from 4.3% to 1.3%. In addition, compliance increased from 43% to 83% compared to IPCs, and hospitalization was shortened from 5 to 4.2 days. Using ActiveCare plus SFT system. Pre-operatively, sleeve application. Apply sleeve to non-operative leg, making sure you have a snug fit allowing for a 2-finger gap between the sleeve and the leg at both the knee and ankle. Place the sleeve with tubing at the knee. Fasten the top flap first, smoothing the sleeve down the back of the leg, fastening the middle flap, and finally the bottom flap above the ankle. In the OR or intraoperatively. After you apply the sleeve, attach the long tubing and turn on the device. The black power button is located on the back of the device. Please note that the long tubing is only used in the OR. Post-surgical procedure. Turn off the device. Then detach the long tubing and store in the OR. Apply the second sleeve starting with the top flap and working your way down. Attach the short tubing to both legs. Then connect to the device. In either the OR or PACU, turn on the device. The opening screen will appear, followed by a configuration setup screen. Once setup is complete, hit the menu button at the bottom right. This step can be done either in the OR, post-operatively, or the PACU. Then press the New Patient button twice, once to select, the other to confirm. The device will display the new patient ID number. After this is displayed, press OK. Make sure the compliance bar reads 100%. If not at 100%, turn off the device and repeat the steps. After the new patient is selected and confirmed, you won't need to press any other buttons other than on-off switch. The system will do the rest for you. Use the new patient setting only when the patient is starting therapy or at discharge when the patient is getting ready for home use of the system. Then bring the device and charger along with the cradle to the PACU. In the PACU, plug in the charger to an AC outlet and connect it to the device. Make sure the display indicates 2 sleeves and the compliance bar reads 100%. Once you are set up, monitor your patient for comfort issues. If your patient is experiencing discomfort, apply stockinette underneath the sleeve, which is included with the package of sleeves. Do not forget to bring the charger with the patient to the floor. On the floor, plug in the device and make sure your patient is comfortable. On every shift, check the patient's skin and monitor and record compliance levels. The system simplifies compliance monitoring with an easy-to-read LCD screen that keeps track of personal usage. Notify the surgeon if the compliance level drops below 80%. Make sure that the patient does not take breaks for longer than 30 minutes or according to your hospital protocol. The system also makes compliance easy for patients thanks to its lightweight, comfortable, and portable design. ActiveCare Plus SFT is designed to be worn comfortably 24 hours per day. Tell your patients they must wear the device as much as possible, at least 20 hours per day, to get maximum protection against DVT. The system can be used almost everywhere, anytime, including during activities such as physical therapy, but never in water. It should be removed for bathing, swimming, or when in the rain. When patients are walking or leaving the room, disconnect the charger from the back of the ActiveCare Plus SFT device and use the carrying straps as instructed. Place the carrying strap diagonally across the patient's shoulder to prevent slipping or discomfort. The device should always be connected to the leg sleeves. Be sure to wrap up the tubing as shown. Troubleshooting. ActiveCare Plus SFT can detect problems and will prompt you to take corrective action. Please follow the instructions and on the Help menu on your error screen. If any problem persists or cannot be solved, please contact your local ActiveCare Plus SFT provider. The most common problems are low battery, air blockage, and air leakage. Low battery is not likely to happen in a hospital setting, as the unit will remain plugged in for all or most of the time. If it does, simply reconnect the device to the power supply and recharge the battery. A fully charged battery will last 5 hours. Air blockage is usually caused by a kink in the tubing. The device will inform you which leg is affected. You can usually fix a kink by checking the tubing and smoothing out any kinks or blockages you see. Air leakage may occur when the tubing isn't connected properly. If you get this message, make sure all your connections are secure. The majority of other problems can be solved by rebooting the system, similar to what you would do for a computer. Simply turn the device off for a minute or two, then turn it back on. Discharge. When it's time for the patient to go home, the ActiveCare Plus SFT system goes home too. The patient will either receive a new device or it will be the same unit they wore in the hospital, depending on your hospital protocol. Before turning off the hospital device, you can add and record data in the patient chart. An MCS representative will also supply each patient with an extra set of sleeves. Ensure that the patient goes home with the device, charger, tubing, and extra set of sleeves. If a new pump is going home with the patient, recirculate the hospital pump and tubing according to your hospital's protocol. Caring for the ActiveCare Plus SFT system. ActiveCare Plus SFT is easy to care for and maintain. To clean any part of the system, you may use a damp towel or 70% based alcohol solution, but do not wet the pump. When the pump is recirculated, it is thoroughly cleaned per your hospital's protocol. You have now learned how to use ActiveCare plus SFT from pre-op to post-op to the nursing floor and discharge. Let's review some do's and don'ts about the system. Don't get any components near water. Don't forget to check for a 2-finger fit after applying sleeves. Don't turn on the device until you have attached the tubing. Do use the new patient button when patient is starting therapy. Do check the patient's skin and monitor compliance levels on every shift. Do contact the surgeon if compliance levels go below 80%. Do stress the importance of wearing the device as much as possible, at least 20 hours per day to get maximum protection against DVT. If you have additional questions or need more information, consult the user's manual, the outpatient provider, your MCS representative, or the ActiveCare plus SFT hotline at 1-800-377-5804. If you have medical concerns, contact the surgeon.